This is the news in brief from the United Nations. The delivery of life-saving aid and medical supplies to millions of Afghans must not be cut, the UN Health Agency said on Wednesday, citing a threefold rise in the number of trauma cases. According to the World Health Organization, 70 of the health facilities it supports across Afghanistan treated nearly 14,000 conflict-related cases last month. That compares with only 4,057 cases seen a year ago. Sustained access to humanitarian assistance, including essential health services and medical supplies, is a critical lifeline for millions of Afghans and must not be interrupted, said Dr. Amir Al-Mandari, the WHO Regional Director for the Eastern Mediterranean. Dr. Al-Mandari explained that months of violence has heavily impacted Afghanistan's already fragile health system, which, in addition to the many challenges posed by the ongoing COVID-19 pandemic, continues to face shortages in essential supplies. The WHO senior official also insisted that the UN agency was committed to staying in Afghanistan despite the uncertain situation following the Taliban takeover on Sunday. His comments come a day after WHO dispatched trauma and burns kit equipment to Kabul's Wazir Akbar Khan Hospital and enough basic medical kits to assist 10,000 people for 3 months. Reliable fuel and electricity are needed urgently in Lebanon to avert a potential humanitarian catastrophe, the top UN aid official in the country has warned. Najat Roshdi, UN humanitarian coordinator for Lebanon, said that fuel shortages are threatening the provision of essential health and water services, putting thousands of families at risk. The energy shortages have forced the country's largest hospitals to reduce their activities further, which, combined with the COVID-19 crisis, may affect the delivery of life-saving treatments, Ms. Roshdi said on Tuesday. Public water supply and wastewater treatment systems that rely on fuel have also been cut back, leaving millions without access to water. Nationwide, roughly 4 million people have been affected after the country's chief electricity provider halted supply to water authorities. In an appeal to restore the current, Ms. Roshdi called for all stakeholders to work together to find a sustainable and fair solution. A warning now from UN Rights Chief Michelle Bachelet that transgender people still lack protection from abuse around the world amid an alarming rise in hateful discourse against them. In her appeal to push back against proposals that roll back protections against the trans community, the High Commissioner for Human Rights insisted that wherever they live, their rights should be respected in law and in practice. Speaking at the Copenhagen Human Rights Forum on Tuesday, Ms. Bachelet said that every country in the world should recognise trans people's gender based on self-identification. Although there have been advances in legal protections of trans rights since Argentina's pioneering law in 2012, only a small minority of countries have taken similar steps, the High Commissioner said. She cautioned that where laws recognising the gender of trans people do exist, they are often accompanied by deeply abusive and humiliating requirements, from forced sterilisation to medical certification and divorce. That is not by any means inclusive, she said. Ms. Bachelet urged both for freedom to be who you are without fear or persecution and to love. Katie Dartford, UN News.